Public health departments play an important role in improving and protecting the health of individuals and communities. As COVID-19 continues to spread, health departments all over the nation are closely tracking the spread of the virus and providing messaging to help slow transmission. I recently visited with the executive director of the Williamson County and City's Health District, Derrick Neal, to discuss their efforts here in Williamson County. It's an honor and privilege to be with Derrick Neal. He's Executive Director of Williamson County and City's Health District. Welcome. Thank you for being with us today.
Thank you for having me.
Got a series of questions because there's a lot of people in not only Georgetown but Williamson County that want to know some answers to some questions. So we got several questions for you. First of all, COVID-19 has impacted all aspects of social life, business, and government. How has it affected your operations at the health district?
Well, we typically work out of 4 different centers around Williamson County. One is down the street in Georgetown. We've recently, as a result of COVID-19, centralized our operations into the Emergency Operations Center to better support us in responding to those individuals who have COVID-19. And we've really put a lot of our other programs on the back burner temporarily until we're able to get our hands around this pandemic, the first of which this country has experienced in 100 years.
Yeah. Any other changes that you had to make, or are those just the main ones?
Really, our scheduling is different. We're working around the clock now. We're working 7 days a week. We have a 24-hour call center. We want to make sure that we keep Williamson County calm in the storm. That's important, and really assure the residents that we have a handle on this because this is what public health does. We investigate, we surveil, and we investigate to the end of identifying those individuals in our community who have COVID-19.
Well, I thought I was exhibiting some of the symptoms of COVID-19. What are some of my options?
Well, you have a couple of options. The first, I would suggest go to our website. We have a criteria screening tool that's there. That'll give you a baseline to let you know if you need to go talk to your personal physician. But again, the tests are reserved for those individuals who exhibit risk, are at the highest risk for contracting COVID-19. So we really want to make sure that we're clear on that because we have a finite amount of resources and tests that are available in this county. So that's critical that our residents are educated to know if they even need a test at all.
So how do you determine who should be tested for COVID-19?
Initially, the baseline was, do you meet the algorithm for travel? Have you been to Wuhan, China, or any of those other places where the numbers have spiraled out of control? That's the baseline that we use, and if you have, then we want to make sure that you are properly evaluated at the airport and then when you return to your home county. With that being Williamson County, our epidemiologist will follow up with you and ask you a series of questions. And if you're deemed to be at risk, then you'll be quarantined for that 14-day period that everybody's hearing about. If you are deemed to be positive for COVID-19, then we're going to do an intense investigation to see who you've been around with regards to Williamson County residents so we can quarantine those individuals. And that investigative group can be pretty large. And right now we're trying to really narrow our criteria in terms of who needs to be identified as being possibly exposed and those who may not exhibit a risk at all. So that's a challenge in of itself because you could, for instance, have one individual who is positive for COVID-19 in Georgetown, and they may have been around 60 or 70 people for the last 3 days. So we have to make contacts with all of those individuals. So it can be pretty intense, and we need support to carry out those type of functions.
Okay. Derrick, as we've seen, the numbers keep increasing each week. In order to stay ahead of this virus, what organizations are y'all collaborating with and working with to mitigate the impact of Corona-19?
As I mentioned, again, all county departments are on board with what we're doing. The local hospital systems are really critical to the prevention efforts. We've partnered with them in terms of securing the negative pressure rooms. Those are important resources to have while we're treating individuals who have been diagnosed with COVID-19. So those are important. Lone Star Circle of Care, the Federally Qualified Health Center, they've been given an allotment of tests. So we're utilizing those tests as well for the higher risk populations. We're also working with Bluebonnet Trails because the mental health piece is extremely critical when you're dealing with COVID and the homeless population. We want to make sure that that elusive population doesn't put more citizens at risk. So from our perspective, Mayor, all hands are on deck. We've partnered with the grocery stores because we want to make sure that the citizens over here where I live off of University are practicing safe social distancing behaviors, because a lot of times we can be the greatest detriment to recovering by not adhering to sound principles. And I do want to add this part. You and I are sitting here today and we feel relatively healthy. The thing that we have to realize is that people who we come into contact with may be vectors, and we could somehow attract that and carry it back to our home or a community place. And that's why the sheltering at home is so critical, because you can be a perfectly healthy vector, but take the virus back to someone that has an underlying health condition, or they may not be prepared to fight the disease based on something else that may be going on. That's why it's so important for us to be not selfish at this time.
Right.
Yeah.
Well, Georgetown has a wonderful age-restricted community called Sun City. We have a lot of seasoned citizens out there. What steps is the health district taking to mitigate the impacts of the virus? Because the over 65 group is more at risk than others, I believe.
You're right. That, again, because that group, the senior groups tend to have underlying health conditions because that's what comes with the aging process. We're really rooted in the CDC guidance, and what we did right away was we partnered with law enforcement to come up with and our health authority to develop directives for nursing homes, assisted living facilities, in terms of banning the outside individuals who come in, because again, when we talk about vectors, it's those outside individuals that can pose a potential risk to those seniors that live in those particular assisted living facilities and those senior communities, specifically in Sun City, Texas. So that was something that we got a handle on right away. That happened the same week that we opened up the EOC. We had sheriffs go out and deliver those directives, not only to the senior facilities, but also to the hospitals, because we wanted to make sure that individuals weren't coming there unknowingly exposing those individuals in the hospital who are trying to recover or going through something that was relatively recent. So that's something that we got a handle on right away. But again, that's part of the CDC's protocol. So we knew going into this what we were going to have to do and the steps that we were going to have to take, having already identified those communities.
Have you seen any modeling that would indicate when COVID-19 would peak, provided, you know, the safe distancing requirements are adhered to, not only in Georgetown, but in Williamson County?
Well, we've already had a COVID-related death that's been documented, which was last week, I believe. The modeling tells us that we should be peaking in Williamson County around the end of May, sometime in early June. But again, that's based on the data that we have. One of the things I tell people is that New York is a lot more dense than we are. We're kind of spread out. But we have to realize that the trend of this disease still needs to be adhered to with regards to, if we look at the trends that are happening on the East Coast, ultimately they're going to come to pass here. We just have to be ready, and what we can do is take lessons away from what some of our East Coast cities, specifically New York, failed to do in a timely fashion, and we're just trying to not repeat those same mistakes.
So once we hit the peak here, where we think it's the peak, What needs to continue on after that peak so that we can get back somewhat to life as we know it before the coronavirus came into Williamson County?
Mayor, I don't know if you expected me to say this today, but I don't know if life is going to be like it used to be ever. I've lived through Katrina, Rita, Ike, and Harvey most recently in Victoria County, and even a little bit of Ebola during my time in Abilene. And communities do become more resilient, but they're never the same. The culture of those communities change, and this is going to be what I would say is a global shift. We're never going to be sitting in restaurants as close as we used to. I see movie theaters changing because COVID is, I don't want to say an evolution. I think my staff will get on me, but it's almost a big brother to SARS. And you're going to see these viruses mutate and manifest themselves and become stronger. But we have to become more smart, more sensible as a population to know that we have to not help these viruses achieve their end, which is to destroy us. So I don't know if normalcy as we know it in Williamson County or anywhere in the U.S. will go back to what it was. I just think that we're going to have to be smarter in terms of, how we expose ourselves and what we expose ourselves to. But life changed right away in all of those places that I've lived in as a result of going through an emergency event. So I don't know if normal, it's going to be a new normal.
The new normal instead of the normal. Was there anything that keeps you awake at night on COVID-19?
Yeah, it's what we don't know about it. I think we know about 75% of this disease. We know how it's spread, and we do a great job of communicating that. We know how to prevent it. We do a great job of that. But we don't talk enough about what we don't know. And you don't know about a disease in its totality until it's ran its course. And that's the sad part about it. We won't know how to truly conquer COVID-19 until the curve is gone. And I have to say this, after that curve is gone, we're going to relax and let our guard down. Public health is expecting a resurgence, not at the level that we're anticipating that it will be, but we're expecting a resurgence because people will put their guard down, but we have to be prepared for that, and so it won't become an epidemic again. So that's what keeps me up. It's the unknown when it comes to COVID-19, and I wish the powers that be, or the folks on television, would say, hey, it's something about this disease that we don't know. And Americans are resilient enough and intelligible enough. Well, we're comfortable with that level of information as opposed to giving the perception that you know everything about the disease, because we simply don't.
Well, what are some of the ways that the good people of Georgetown and Williamson County can help the health district and you?
Really educating themselves, being good, what I call public health ambassadors. And a good public health ambassador is someone who utilizes the information that's on our website or on the Center for Disease Control's websites and educates their neighbor, educates someone in their family, and obviously really focus on using those universal precautions because they do matter. This disease, this virus, lives on surfaces for up to 72 hours. It's very hardy, and I don't know if I've washed my hands this much in the past 90 days in my entire life, but I'm cognizant about it, and I just think that we have to be more responsible citizens to our neighbors and not just think about ourselves. We have to be selfless in that we have to put other individuals first. It's kind of like being a Christian. My grandma used to always say, man, it's really loving that person who you don't get along with the most and taking care of them. And that's the true mark of a Christian. And so really just being more concerned about the stranger that's sitting to your left or your right than you are about your own individual health. So this is really focusing a lot of us to be more humble in a lot of aspects of our life. So if there's any one unintended consequence that I didn't think about is we're being forced to care for each other, and I'm really appreciative of that.
Well, I want to thank you for all that you do. I mean, what you're doing is a noble calling. This is God's work. You're making it a better world for your brothers and sisters because we're all in this together.
Yeah.
I really want to thank you for your time today. I know that you've got a busy schedule, and I also understand that you're in a very stressful position, and I'll be praying for you each and every day. Again, thank you for being with us today and sharing this information. We'll share this with the people of Georgetown and Williamson County.
Thank you for the opportunity.
For more interviews about how the COVID-19 outbreak is impacting local business, government, and healthcare, click here. And to keep up to date with city news, visit georgetown.org. Thank you for watching.